Thank you for tuning in tonight to the Humboldt County Virtual Town Hall on novel coronavirus, COVID-19. Our goal is to provide the residents of Humboldt County with the most up-to-date information regarding state and local response to this virus. Tonight we have a panel of 5 county leaders here to answer your questions. We have already received numerous questions so far from the public and will continue to accept those questions throughout this broadcast. Half of the questions posed tonight will also come from local media. Community questions can be submitted on the HumCo COVID Facebook page or at humboldtgov.org/COVID Town Hall. Our panel tonight consists of DHHS Director Connie Beck, 2nd District Supervisor Estelle Fennell, Health Officer Dr. Teresa Frankovich, Sheriff William Honsal, and Public Health Director Michele Stevens. Also here with us tonight is Thadeus Greenson, longtime news editor of the North Coast Journal. Thadeus will be moderating tonight's Q&A panel. Before we get started with our panel discussion, we're going to hear from State Senator Mike McGuire regarding the state response to COVID-19. Welcome, Senator McGuire.
Well, thank you so much. I'm really grateful to be with you, and I just want to take a moment to say thank you to the amazing group of leaders who are in studio tonight and say how grateful I know I am and so many across the county are showing your incredible strength during these challenging times. I'll be the first to say that we have some tough days ahead. It was the deadliest day in America thus far for this virus, but I know that Humboldt County's generosity, our commitment to community, and our pure grit is going to be our strength that's going to get us through in the months ahead. If it's all right with each of you, would like to be able to provide a very brief state update where we're at and where we're going, both on the North Coast as well as throughout the state of California. First and foremost, I'd like to be able to focus on all issues of hospitals and health clinics, protective equipment, as well as other medical supplies. We remain in constant contact with hospital and healthcare CEOs across the North Coast and right here at home in Humboldt County. We want to make sure that their needs are being met with protective equipment as well as medical supplies. The good news is the California Office of Emergency Services has started just last week delivering mutual aid for personal protective gear and other medical equipment. These deliveries are going to continue this week into the weeks to come, and we're also coordinating with Humboldt County on all issues of mutual aid. And I want to take a moment to say thank you to Humboldt County Public Health and the local Office of Emergency Services for their incredible work over the past 2 weeks and the weeks ahead. The state believes at a minimum that we're going to be under a shelter-at-home order through May 1st. The bottom line is this, and it's unfortunate, but the virus is continuing to spread, and hospitalizations are continuing to increase across the state. At this point, the majority of hospitalizations are south of us, not necessarily on the North Coast, but we are seeing a slow tick upward with confirmed cases. The vast majority of the cases remain in the greater Bay Area and the LA metro region. I want to give you the latest statistics. Between Friday and Monday, California saw a nearly 200% increase in ICU bed utilization and a 100% increase in patients being hospitalized. We still believe, and this is a moving estimate because testing is still a challenge, our peak for the virus could still be approximately 2 to 4 weeks away here in California. Our top priority, though, remains that rural California has the resources needed to be able to combat this virus. And this is truly an all-hands-on-deck effort. And speaking of that all-hands-on-deck effort, look, we know that challenging days are in front of us, but we are coming together like never before. The legislature 2 weeks ago today passed a $1.1 billion spending bill that's going to be expanding hospital capacity in every corner of this state. We're moving forward with 8 field hospitals that are going to be developed. We're opening up 3 formerly shuttered hospitals, and the Mercy hospital ship is now docked for the duration of this crisis in the port of Los Angeles. That's going to expand our capacity by about 1,000 beds, and I'd like to focus on bed capacity for a quick moment. Currently, California has just over 400 hospitals located in rural and urban and suburban parts of this state. Our goal is to expand capacity of beds by 50,000. So prior to this virus breaking out, we had 74,000 beds. We need an additional 50,000 on top of that 74. Here's how we're going to do it. We're asking every hospital in the state to expand their capacity by 40%. We're going to get 30,000 additional beds from hospitals, and the state is going to be responsible for developing an additional 20,000 hospital beds, which is why we need to reopen formerly shuttered hospitals and develop these 8 field hospitals. I'd like to talk quickly about homelessness. California's homeless population is one of the most at risk and susceptible to spread. To help combat this, the state is going to provide Humboldt County with $635,000 immediately to secure hotel rooms throughout the county. These funds are extremely flexible and already being put to work. I want to take a moment and say thank you to the Board of Supervisors, the Chairwoman Fennell, for their quick action on this. And this is on top of the nearly $3 million in flexible funding that has been moved into the county earlier this year through our typical homeless funds. So those actions are moving right now, and I want to say thank you to the Board of Supervisors for their quick action. Quickly on unemployment, over the last 15 days, over 1 million Californians have applied for unemployment. The state is going to provide residents with up to 6 months of unemployment, a maximum amount of $450 per week. The good news is the federal government just passed on a bipartisan basis their federal virus stimulus bill. That will add a maximum additional $600 per week for 4 months. So an individual could get a maximum amount of about $1,150 per week, but you need to get signed up for unemployment. Please go to edd.ca.gov, to be able to get your application in. Currently, there's a 3-week turnaround time from when an application is submitted to when checks will start flowing. So we encourage you to be able to get in. The state has also reopened healthcare benefit enrollment through Covered California. If you've lost your health benefits due to the virus and the loss of a job, you can now enroll on state medical benefits through June 30th via Covered California. Simply Google Covered California benefits tonight, and that will take you to the home page. Finally, 2 last items. California has activated the California National Guard. That is helping us, those Guard members, and we're grateful to them, are helping us expand our hospital capacity. And they're also fortifying food distribution channels and expanding food bank operations. The state has pumped about $6 million just last week into the food bank network to help them purchase additional food. Another $14 million is on the way from the state to greatly expand food purchasing above and beyond that $6 million. And we need to make sure, of course, food for people is taken care of here in Humboldt County. And finally, on small business. If you're a small business owner, I can't say this strong enough. You got to get onto the Small Business Administration website, sba.gov, and apply for a low-interest loan from the Small Business Administration. And the federal government, through their stimulus bill, there's some really good, firm language in there for small-time employers. The bulk of the businesses in Humboldt County have 50 employees or less. Here's what the federal government stimulus plan is going to do for you. If you make the decision to furlough your employees and not lay them off at this time, and you keep them on for the next 4 months, the feds are encouraging you to apply at sba.gov for a loan. The feds, after the 4 months, and you keep your employees on the payroll, up to 90% of that loan will be forgiven and it'll be turned into a grant. In addition, you'll be able to take up to 50% of your federal taxes off the next year of your tax returns. So it's a really good plan, but you have to get into the SBA website, sba.gov. I appreciate being with you tonight and happy to answer any questions here at the end of the town hall.
Thanks for that information, Senator. We appreciate it. So before we begin our questions, I'd like to give Dr. Frankovich and Sheriff Honsal the opportunity to give us a brief local overview of the current COVID-19 situation. So first, Dr. Frankovich, I know you've played a huge role in this response. Could you tell us a little bit about the current situation and how you and your team are holding up?
It's been a lot for our staff, and I can't thank them enough for their dedication. Public health staff are working long hours and through weekends to try and address everything that needs doing, and I know our partners are doing that as well, so I really appreciate it. We have come a long way in a very short time in aggressively addressing COVID-19 in our community. I really appreciate the sacrifice and effort everyone in the community is making to slow transmission of the virus. As we look at what is happening across the country, it's becoming increasingly clear that maximizing our social distancing by sheltering in place can have a profound effect on how quickly case counts rise and can help to buffer the impact on our healthcare system. That means when they need it, people will have access to the appropriate health care. That's the goal. Today, I can tell you that case investigations for confirmed cases have been progressing. As of late today, we believe this means is that after hours of looking at what each case has been doing, where they have been, who they have had contact with, there is no apparent connection to a known case and no travel suggesting that they encountered the virus elsewhere. So we have anticipated this. We knew that with increased testing and as things progressed, we would identify it. And it sets the stage for the next phase of our response. Today, I issued a revised order for clarification and to address issues of concern, including things like vacation rentals and parks. I want to emphasize again that we must all acknowledge the fact that while case counts are incredibly important for monitoring this pandemic, everyone must assume that COVID is circulating within their own city or town and act accordingly. The measures we have been advocating remain critically important. Staying home unless you must go out for an essential need, staying home when you are ill until you have been without fever for 3 days without use of medicine for fever, have had improvement in your symptoms, and have had at least 7 days since the onset of your symptoms. Wash your hands frequently and well. Use hand sanitizer when that is not available. Cover your cough and sneeze. Clean commonly used surfaces. And I'm sure tonight we'll be talking about masking. Thank you.
Thank you so much. Sheriff Honsal, can you give us an overview regarding our Emergency Operations Center and law enforcement?
Yes, good evening. The Sheriff's Office of Emergency Services has opened the the Emergency Operations Center to support our mission here. Our objectives are to maintain public safety and also support the public health in their mission. Also to provide timely information regarding this emergency, and also to coordinate our emergency management operations. That is our key objectives in our Office of Emergency Services for for this particular event. This is an unprecedented event, as we've seen throughout the county. And today I decided to proclaim a local emergency because of it. It's all due to the escalating public health emergency that we all see, and its impact on services, personnel, infrastructure, facilities. I decided to declare that local emergency. By declaring that a local emergency, it provides pathways to coordinate with our California Office of Emergency Services to also request state funding and federal funding in regards to our response and recovery. This is a long haul. We are in the beginning stages, and I think everyone needs to realize that. And so part of our job is to plan. Part of our job is to take in good information and work with public health and start planning for what is going to be a month from now, and coordinate that and look at our capacities throughout the county. And so that's what we're doing right now. It is essentially that calm before the storm. And so Right now, just like Dr. Frankovich said, it is very, very important that everyone adhere to these strict guidelines of sheltering in place. And a minor inconvenience now could mean that we're out of this a lot sooner. I do want to say that I reached out to all the chiefs of police, the CHP, and the district attorney to check in on what life is throughout the county as far as law enforcement goes. We've all seen a dramatic drop in crime and calls for service during this shelter in place. And so overall, everyone has been doing a very, very good job. And so that is very, very refreshing. I'm very, very happy with our community for doing that. Essential businesses are remaining open. The non-essential businesses are closing. We have had some businesses that have had to stay open, and we've given them notices, and they've shut down. So overall, our compliance has been very, very good. And so we're looking forward to maintaining that. But also just want to remind people too, the district attorney's office is still open. They are coordinating victim witness services. California Highway Patrol is still out there and wanting people to reduce their speed. The roadways are really clear right now when you're going around for essential services, but we see a lot of people using the roads for their own personal pedestrian highways. So look out, be vigilant, and so we don't want to have the crashes during this time.
Thanks, Sheriff. At this time, we're going to open up the panel Q&A. As a reminder, viewers at home can participate in this panel by submitting their questions to our HumCo COVID Facebook page or at humboldtgov.org/COVID Town Hall. We're compiling these questions for our moderator, North Coast Journal News Editor Thadeus Greenson. He'll be asking your questions as well as questions from members of our local media. We do have limited time tonight, and we have already received hundreds of questions. While many of these questions overlap, please know that we will not be able to get to all of them tonight. We will do our best to follow up with you online after this event. Additionally, our COVID information line will remain open tonight until 9 p.m. for any questions that you may have that weren't answered tonight. The number for that line is 707-441-5000. We also have a Spanish speaker answering that line for our Spanish-speaking communities. We will give you that number again later tonight. Thadeus, you may start your questions now.
Thank you, Samantha. I want to start by just thanking all the members of the public who took the time to submit questions, and to my media partners who did the same, and that includes the Time Standard, Redheaded Black Belt, K-Mud News, and North Coast News. So thanks for participating tonight. So I wanted to start with, I guess, the news of the evening, which is the emergency declaration first and foremost. Sheriff Honsal, can you speak specifically to how that changes the command structure in response to this event and how it enhances potential to coordinate between agencies and potentially leverage state resources?
Yeah, absolutely. So it's a key component to this emergency. You know, we have an emergency operations center here in the county, and it's up and running. We were initially open to support public health. Now this is a county-wide emergency. So it is a public health event based on public health information, but this has affected the entire county. So it is my job to coordinate that and to coordinate that response and to help with logistics and the planning of things, but also the finance piece of all this. So we are working together right now, and we have command structures, we have all of our objectives in place, and we also are prioritizing the information that's going out. We've established a joint information center, which is essentially 20 personnel that are assigned to answering the phones and to providing information to the public based upon what we're seeing from public health and other emergency agencies throughout the county. But we're there to support not only the county, but the cities. For the cities to obtain resources from the state, they have to go through my Office of Emergency Services. And every city has declared a local emergency in their jurisdiction, essentially. And so they are going to coordinate through us when they need outside resources from Cal OES. And so it is a coordinated effort. It's continued to be a coordinated effort with Dr. Frankovich. We have a key policy group that meets every day, which is essentially me, the CAO, Dr. Frankovich, and our key leadership teams that are making policy decisions for the county in response to this emergency. But the biggest thing that comes about this is that state and federal reimbursement. Federal reimbursement up to 75% for response and recovery for this emergency, as well as about 18% from the state. Something like this could essentially bankrupt any jurisdiction. And so we want to make sure that we track those expenses and that we are properly reimbursed because of the federal declaration of emergency as well as the state.
Excellent. And just a quick follow-up to that, I mean, with an emergency like this that could really conceivably span months, is there any guarantee from the state or the feds that those reimbursements will come more quickly?
Well, like Senator McGuire said, there's already been emergency funding provided by the state and the federal government. And so that is already coming in certain aspects of things, but for specific purposes like homeless and some of the community response. But overall, our expenses that we have, that will come eventually, and we're optimistic that based upon the past emergency events that we will be reimbursed from the federal government and the state.
Okay. All right. Thank you. Dr. Frankovich, we have gotten a ton of questions about testing. So I think I want to start there, and if you could just tell us, kind of bring us to speed on how testing has gone, what the criteria to date has been for who gets tested and who doesn't, and then how today's announcement of potential community spread does or doesn't change that.
Sure. So, and I understand lots of questions. We are very fortunate here to have our own public health lab. Many communities do not have access to that resource. And so one of the really important responsibilities we have with that is to be able to provide a quick turnaround time for testing when it is critical to get an answer quickly. And so all along we have prioritized using the lab to be able to test, for instance, patients admitted to the hospital, patients particularly in critical care, patients who are a contact of a known case, so are at higher risk, and including patients who are at higher risk for serious consequences themselves. What we're doing is, as our testing has ramped up and our supplies have increased, we have been able to increase the number of tests we can do in a day, and that is really helpful to the response. There is new technology being approved for testing all the time. I'm sure people are aware of that when they look at what's out there in the media. And one of the potentials is just some quicker turnaround on some of our PCR testing, we call it One Technique. And so we are avidly working to have that capacity on site. But again, I think people have to understand that we have to, in addition to the machines that run our tests, we have to have all the ingredients that you need to make those machines work and complete the testing. So that's an ongoing endeavor of ours to secure those things. And right now, I think we're well positioned for what we need to do currently. What I would like to do is beyond that in terms of surveillance testing. And as we're able, we're trying to broaden that net of who we test so that we can include individuals perhaps who don't fit any particular category, but are important to just identify in terms of surveillance. The commercial labs help us with that as well. And so patients for whom it's not as critical to get as fast a turnaround time, we can actually utilize that service, the providers can, to just increase the total number. I do want to point out, as frustrated as people are at times about this, our lab has been able to, in combination with commercial labs, provide more testing per capita than we're seeing nationally or in the state of California as a whole. So I think we're over or around 500 people already tested in a community our size, and I think that's an astounding testament to both our lab personnel, who I was working with on Saturday, who were there 12 hours running tests, and also to our provider community that's trying to be responsive and test people and help to provide information about our status in the community.
Excellent. And when you say working to make sure that there's enough of the equipment and materials necessary to conduct the testing, is that just going to Cal OES to ask if they have more, or is it going to various vendors throughout the country? What does that process look like?
Right. And so for these particular things, it's not really through Cal OES. Initially, we were getting everything through the CDC, and now it's through vendors and funneled in different routes. But for instance, we do have a piece of equipment on site that would allow us to increase our testing run without purchasing another piece of equipment. But again, it's securing those modules that are needed to do that testing. So everyone in the country is trying to increase their testing. And we are in queue with other individuals to get those things. And I just want to assure people that we are as eager as they are to ramp up testing even further. And we will put it in place as quickly as possible.
Sure. And what, if anything, does today's announcement about community transmissions, how does that impact testing strategies or the criteria for who gets tested and who doesn't?
Sure. So I think that, again, for quite a while now, we've been sort of commenting to the public that in all the other communities that we have watched as this evolves, you know, it's quite clear there is circulating community transmission before we're able to identify it. And so we've been sort of talking about that part of the reason for the shelter in place is because we were anticipating that there may be low levels of the virus in our communities, and it was important at that moment to draw everyone back so that we would not be spreading it more quickly. And of course, the same day we did that, the governor issued his order that evening. I think the community transmission just tells us, and again, for everyone in our community, that once this is spreading person to person without known contacts, everyone has to behave as if every social interaction is a potential to contract the virus. And that is the reason for minimizing that social interaction as much as possible and using all those precautionary measures.
Excellent. Thank
Thanks.
you. And I'm not sure if this question is for Dr. Frankovich or Director Stevens, but a lot of focus to date has been on contact investigations. And so I'm hoping one of you can kind of walk us through this process of a contact investigation and working back from, you know, a positive test to tracking how that person may have contracted the virus, and then also who that person has come into contact with, because it strikes me from the outside looking in that it must be incredibly labor intensive and time consuming.
It is, and if people are interested, you can actually find online models for this and what it looks like in terms of a big branching tree for these investigations. So all of these investigations begin when we become aware of a case. We then talk to that case. We get a history that includes any risk factors they may have for having come in contact with this. Do they know that they were with someone who was positive? Have they traveled to an area where there's community transmission? And so we look at those right out of the gate. Then we look at a timeline for them. When did their symptoms begin? And what were their movements like during that period before they realized that they had a COVID infection? So looking at their household, looking at who visited their household, looking at, were they at work? Were they in some other setting that was congregate? And then looking to see what that looks like for those individuals. How close a contact? For how long? And does it put them in a risk category that suggests they may need additional quarantining, that type of thing? When we identify people who are at risk, we are contacting those individuals, and we are checking to see whether they have symptoms. And if they do, obviously they need to be assessed. And if they don't, then looking at making sure that they understand that they need to be in quarantine because of their exposure for that 14-day period we've been talking about. But as you can imagine, every person you identify along the way potentially branches out to other individuals. And if anyone else in that investigation is symptomatic, we start from square one with that individual to all of their activities and contacts. And again, it blossoms really quickly. So it is hours and hours of investigative work. I'm sure the sheriff can relate to that in terms of the work that the police force does. And so that's why, and we're not quick to come to the conclusion. Someone that we initially think may have no known contacts, we actually can piece together that they in fact did. Mm-hmm. And that's important to know because, again, it goes to that issue of, is this someone who was a traveler or a contact of a known case, or is this actually just evidence of some spread that's occurring in the community without any known source?
And with the confirmation of 2 community spread cases, do those contact investigations become less important, or do those continue?
Not at this time. Just like the social distancing, this is a point in this pandemic where we can still impact how quickly it unrolls. And so by identifying those contacts, by quarantining people, by identifying people who may have picked up the infection from that contact and quarantining or isolating those folks, we can start to put the brakes on any additional spread. It's hugely important. As you're referencing, when we begin to see widespread COVID, at some point along the way, this containment strategy isn't very useful anymore. And we direct the resources elsewhere. But at this moment, it's one of the most pivotal things we can do.
Okay, excellent. So you talked about kind of the critical moment we're at, and Senator McGuire earlier talked about kind of the vulnerable position that the homeless population is in. So I'm curious to hear from Director Beck what DHHS is currently doing to protect the homeless population, to get them how they're able to be quarantined while either symptomatic or awaiting test results, and how that effort may or may not be disrupting other DHHS services.
Sure. So we have secured 14 rooms in one of the local motels for people that need to be quarantined and or test positive. We're also looking at securing additional rooms for our most vulnerable population of the homeless, which are the seniors and folks with chronic illness. We are also working, distributing hand washing stations, porta potties. We're working with our medical providers to do a screening at our local free meal and Arcata House partnership when they're giving out meals. Let's see, what else? What else are we doing, Michele?
Are there currently any efforts to expand shelter capacity in general on a larger scale?
Yeah, so just today, I've been trying to secure actually a lease for the entire motel that we've been working with. We also need to secure rooms throughout Humboldt County, not just in the city of Eureka or Arcata, but also in like southern Humboldt. There's a motel in Garberville, so we'll be working to secure those now. But yeah, so I just was on a call this afternoon that FEMA is actually going to be able to refund 75% of the cost of the local motel lease. That's huge for us. In addition to the $670-some thousand that we have, we're going to have that additional money. So for us to just be able to move on that now. We do have a person identified that's working in the command center now that will be working on that grant application. Yes, the homeless piece has been an additional task for us, but not something that we shouldn't be doing anyway. There are increases in need, upticks in our applications for CalFresh and CalWorks. So those are all things that we have to deal with as we go along too. So
Absolutely.
If I could just add to, one of the things that we have to work out is the finite detail about how to get an individual who might be experiencing homelessness, who's being tested from the clinic or the hospital to the hotel, and do that safely. And so we've got staff working on protocols and the screening protocols for how to screen people when they're at free meal, for example, or our Arcata House partnership, and then also when they're getting tested and they're waiting for results, how to get them from that location to the hotel, get them meals while they're there, while they're awaiting results, and then if they test positive, staying for the time that they need to stay there and have meals and whatnot. So all of that takes a lot of work and staffing, and we're grateful to the partners that are working with us in providing staffing for that as well, not just DHHS staff.
Excellent. And to date, I mean, do you feel that your staff has the personal protective equipment to keep them safe throughout all those contacts?
We're working on it.
Chair Fennell, I'm curious to hear from you what the Board of Supervisors' role is in this countywide response. How the board can or can't support efforts by reallocating staff to where it's most needed, things like that, and if there's anything it can do to support small businesses.
Thank you, Ted. Well, we have a number of roles, but basically we are in support of all of the efforts that are being put forward by the Public Health Department and everybody else responding to this pandemic emergency. We will obviously ratify the Sheriff's emergency declaration, as we will ratify the health officer's declaration. This will put us in a position where we can bring those funds into the county. We've also passed resolutions to make sure that our workers could get time off and just explore all the logistics of people furloughing or getting extra pay, etc. I think that the most important thing to remember about this is it's a huge, huge challenge. When you have an emergency, normally we all kind of rush to the scene and there's a group of people and they're all around the car that went over the bank or whatever. Now we have to do everything separate. Even here we have much, much more room. And so it takes more logistics for us to be able to provide all of those services as well. So the supervisor is standing by to make any particular need, to meet any particular need, have emergency meetings, answer community members' concerns, address policy questions to the OES. OES's big issue is advanced planning. That's a strong component of it. How do we get ready for what might be coming down the pike? And then, of course, also being that interface with the community. I think a lot of the community that I talk with now is beginning to understand the wisdom of stay at home. And I'm talking to somebody just today, and he said, I think this might work. And I said, yeah, I do too. So let's keep on doing that and work together. But we're here to support everybody. And I, just for a moment, want to say a huge thank you to all of the emergency responders out there, no matter where, in the hospitals, the firefighters, the community emergency response teams, everybody who has stepped up and done it the right way so that we would all remain healthy. That's a really big deal as well. So we're here for you, and bring your concerns and we'll address them. So that's what we're doing.
Okay, thank you. Chair Fennell mentioned what's to come and preparing for it. So I'm curious to hear from Dr. Frankovich and Director Stevens about modeling that county public health has done, and if that modeling indicates a projection of when Humboldt County is going to see peak infection rates, and what are the best and worst case scenarios of what those are going to be.
Well, what I would say is we are obviously looking at modeling for our area. It's helpful actually as as we're identifying additional cases and looking at how quickly those cases accumulate, that also assists us in modeling. Right now, we're looking at the experiences in other areas and trying to plan for that. I would say our focus right now is, a couple of our main focuses right now are to both do this partial containment strategy of using isolation, quarantine, intensively working on trying to limit the amount of exposure community members have to cases and people who are contacts of those cases. The other big piece of this is planning for surge, what we call surge capacity. So looking at where are we now in terms of beds, both regular medical surgical beds as well as ICU beds, and also looking at things like ventilators, equipment, personal protective equipment. What can we sort of know out of the gate we're going to need more of? Our numbers will get more refined as we sort of watch this unfold. But basically on all fronts, the answer is we know we need more. And so we're already heavily engaged with our health care system partners, hospitals, outpatient, skilled nursing facilities, other entities, to look at where are we baseline with, for instance, beds. Just with rearranging the way they're providing services, where can we get to? Similar to what I think Senator McGuire was saying, how can we build the beds we think we'll need? And then what do we need from the outside
to fill the gap. And so beginning to channel those requests forward to ask for those resources. But in terms of exact numbers, that's going to become easier as we go in terms of anticipating. And we're just beginning with some baseline models that we have available to us by looking at other places.
Do those models indicate when Humboldt County can expect to see the worst of this?
It's really difficult to say right now. I could tell you that where we are now suggests that we have a ways out, that I'm not expecting our surge next week or even the following week. But I think how successful we are in this sheltering in place and containment strategy is what we're doing to try and change any projections, right? So right out of the gate, we're trying to do this so that instead of seeing this sharp peak in cases over a short period of time, we're able to have a lower peak over a prolonged period of time. And that actually will allow us to respond appropriately. So the better we do at this front end right now, compared to some places in this country, we have a golden opportunity that we can seize and be aggressive about so that we can have a huge impact down the road on delaying that surge and making that surge lower whenever it occurs.
Is there reason to believe that the sooner peak comes, the worse it will be?
I think that is true, for sure, because all of this advanced time allows us to be prepared, more and more prepared over time, to get more and more of the resources we need. If other places in the state are sort of past that surge and actually in somewhat of a recovery phase when we are entering that, that opens up a whole wide array of additional resources to us. So I think it is imperative that we take this, as the sheriff said, sort of quiet before the storm or calm before the storm, to really embrace that and try and really put the brakes on here as much as possible.
And you also spoke to surge capacity, and I don't know if this is a question for the sheriff and OES or public health, but it's been frustrating for, I think, local media to try to get capacity numbers from local hospitals, and I could opine about why that is, but I don't know why it is. So
Sure.
I'm wondering if either of you have an idea, actual numbers for countywide capacity of ICU rooms and ventilators.
Sure. So I can speak to that, and this is part of the work we've been doing, and I want to thank Dr. Josh Ennis, who has been leading he's come back onto public health, he's been our deputy, and to really work with the healthcare entities to really put a lot of effort into this area. So what I can tell you, for instance, now is when we look at our total hospital beds across our community, on a normal day, we have about 172 beds that are available to us. With our healthcare partners working on rearranging, expanding, being creative about where they can provide care, just out of the gate, those hospitals, we can get up to about 300 beds from about 170 beds. So that's a huge bump in our capacity by just actually using what we have within the walls. When we are looking at surge and how many beds we might need, we are also looking obviously at sites outside hospital walls, unconventional things, tent kind of settings, depending on how those might be used, other actual buildings that we can incorporate, as well as looking at things like what can our skilled nursing facilities contribute in terms of beds, what other sort of entities in the community can actually free up bed space that can be useful for, say, patients who need some medical care but don't need critical medical care and can do very well in a setting that is not necessarily within a hospital wall. So that's all part of this planning process.
Okay, excellent. And are there any health system-wide discussions about how to reallocate resources across hospitals and community health centers, with the potential of even designating one local hospital as the COVID intake point or the COVID hospital, freeing up capacity for other services at other hospitals?
Because of the breadth of our county, the distances involved, and then the logistics of transporting patients, I think having a single facility that's an intake is probably not feasible. But I think, playing to the strengths of each of our partner hospitals in terms of their staffing, their structure, their critical care capacity, those things will help guide as people need to come into the hospital, guide where they go. And so I think that'll be really important. And I do want to mention another piece of this is that having, for instance, additional beds or additional ventilators is great, and we critically need that, but we also need the people to operate them and to serve those patients. So developing that healthcare workforce is essential. And we've also been working on that front, looking at things like, can some physicians who are currently providing outpatient care services, are some of those people able to provide inpatient services when we need them? Are we able to pull people off our disaster volunteer rosters who are willing to come back in and serve in those healthcare roles that we will need? And so that is a whole other piece of this surge capacity that, again, is very important and we're working very hard on.
Excellent, thank you. And a quick follow-up to that, just because as a member of the public weighed in to ask, you're talking about, or we've been talking about surge capacity and bringing in outside resources like ventilators and stuff like that. Is there any hope of bringing in outside resources in the form of healthcare workers, that people could be pulled from other areas of the state to provide surge capacity?
Well, I think it goes to your previous question about, is there a benefit for us delaying surge here? And I think the very real premise on that is that, again, if we have areas of the state that are sort of managing now and are a little bit after that peak, there may be those additional person power. As you can imagine right now, most places are really doing the same planning we're doing about what they actually need that is outside their county borders.
Okay, excellent. Sheriff Honsal, you talked about the need to maintain the calm before the storm. In light of today's order, I'm curious, does that change enforcement strategies from the sheriff's office?
It really doesn't, but what we're doing is throughout the county, there essentially is all the sheriff's department and the police departments have issued these orders or warning letters to several people and businesses. And so as this continues to go on, we'll be less and less tolerant of people violating the shelter-in-place order. At first, people, again, education over enforcement. We're trying to inform people the benefits of shelter-in-place. But then when people start taking advantage, only tool left is enforcement. And so we will be citing people. We will be, documenting those cases, sending to the district attorney's office for prosecution. It's the last thing we want to do in this time, but we will do it, and we will continue to do that. And if enforcement is necessary, we will definitely do that.
Has the tip line to date proven helpful?
Yes, it has. And so it's given us an avenue for people to anonymously provide those tips for non-essential businesses, for people loitering, for non-compliance with the shelter-in-place order. And so it does give us that opportunity and an avenue to push those complaints off to the different city jurisdictions. And so it's actually been a big help.
Excellent. Coming back to the subject of testing, I'm sorry, I'm directing a lot of questions at you, Dr. Frank.
That's okay.
There's been some frustration in the community of not releasing more demographic or geographic information about the people being tested. So I'm hopeful you can just kind of explain the rationale for not doing that and explain if there is a point when enough people will have been tested or we have enough positive cases that it'll be feasible to release that information in data sets.
Sure. And, I understand. There's clearly, as people are watching this unfold, a desire to have some additional information, and that's always an ongoing balance for us in terms of providing that information and then also doing all the things that we're obligated to do around that information. So again, I've had individuals ask, Los Angeles County is listing every town and city and cases, and my answer to that is, when you're an entity as large as Los Angeles County, you can do that because there is very little risk that announcing where a case is located is going to identify any one individual in particular. And I think now that all of us are seeing on social media instances of people being threatened or, sort of a little vigilante type of activity going on around people even suspected of having COVID, I think we have to be really careful, not only about violating people's medical privacy, but about, not putting people at risk within the community. That being said, I'd like to give the public as much information as we can, so what we're looking at right now is trying to give some reporting around regions of the county, for example, north, south, east, west, give people some indication of location of cases. And I think the other pieces that we can do are gender, because since for reporting purposes it's binary, that actually we are beginning to have the case numbers to be able to do that. And I think age as we go along age ranges will be something we can do as well. So I want people to understand that I'm aware of their desire to have that information, and we're really trying to work to getting people more as we go. I think the regional information we'll be able to do fairly soon, and I think gender as well. I think the age ranges will be a little bit down the road. But one real major concern I have about this is that in spite of the fact that people really feel, I can't even tell you how many times I've heard people ask, well, I want to know that it's not my town, because then, I don't have to worry as much about going out and about, and I don't have to worry about someone in my family who's at higher risk being out and about. And I want to say that the worst thing people can do right now is to assume that if their particular street or town or area of the county does not have a lot of cases, or even one identified case, they cannot assume that means that the virus is not in their particular community. And to do so is dangerous for everyone. So people need to understand that going forward here, if they have not really thought this before, they need to accept the fact that there is risk throughout the county, and we need everyone to behave as if a cluster of cases is occurring in their town.
Excellent. Along similar lines, we at the Journal got some good advice from an epidemiologist saying that the question is not how to avoid contracting the virus. The question should be act as though you have it and prevent its spread. So to that end, is there any consideration, whether it's via countywide ordinance or an order, of requiring people to wear masks when out in public?
What I would say right now is that we are not in a place where we are requiring people to wear masks. What I would say is, and I'm sure people are aware, the thoughts on this are evolving as we go forward. I understand the desire for people to be able to do something proactively to both help their own safety and those of their community members. And I think that, the homemade masks that people are developing, I think that's a tool people can use. I think that as we go forward, it's important for people to understand a couple points. One is that the mask does not, the purpose of that masking that I think we're all talking about is not so that someone who is ill can go out and about. That's not the case. People who are ill are at home, period. I think the importance of it is people who are not ill and want to sort of help decrease the amount of droplets that are out there, should they incidentally sneeze or something, to help them from inhaling large droplets that might be out there. It can be a tool for people in that way. Obviously, these are not masks that are, industry credited, or we don't have any way to know how completely effective they are, but just intuitively one has to think that having something covering your nose and mouth has to help. And for people who can do that, some people with respiratory problems and such, it is just not feasible for them to have something cloth across their mouth and nose, and I understand that. But for people who do want to do that, I think that's fine, but I also do want to remind people that you have to use it appropriately in the sense that it needs to be clean. If the mask is moistened by, sneezing, coughing, those kinds of things, handling that mask and then touching objects defeats the purpose of wearing it. And so people just need to be conscious, just like healthcare workers are. If they have a mask on, they're not handling that mask. And so individuals need to have that in mind as well. And, I can certainly support people in their efforts to move down that path.
And to be clear, we're talking about healthy people wearing masks made at home and not running out or trying to order online a bunch of surgical
Exactly.
masks or N95 masks.
Yes, and I thank you, because that's an incredibly important point, is that obviously the burden for exposure is far higher for healthcare workers, for example, our EMS, people interacting at that level with individuals, and those people have to have those industrial certified masks to be safe. And it is important to all of us that they remain safe, because they're going to take care of us when we become ill. So I think it is completely counterproductive, and I strongly ask people to not attempt to identify those kinds of masks and try and order those. They really need to be available for the key people in our response. And I think these masks for otherwise healthy people are a perfectly good option.
Excellent, thank you. And I guess on the subject of PPE, personal protective equipment, I know Public Health was able to distribute some last week. Senator McGuire indicated there's more on the way. Can any of you guys kind of explain how those are parsed out and distributed locally, and how the kind of need is identified and how they're allocated?
So right now, the Office of our Emergency Services made the request through Cal OES to obtain those precious N95 masks. And so we did get a shipment in this last week, and first priority healthcare workers and first responders. So all of this supply is going to healthcare and first responders to get them properly outfitted. And so once that happens, we're also receiving resource requests from other agencies throughout the county. And then it's our job to steer them to where the resource could be obtained. And so we're working on those right now. But right now, like CDC guidelines are, for first responders, for those healthcare workers, to make sure they have them first. And so that's our priority, to outfit them. And still, I don't think we're prepared enough. So we'll be making more requests for those particular purposes.
Prepared enough just as far as the quantity of stock on hand?
Absolutely.
Well, and for anticipating that need, obviously we want to be in a position where in the moment that we are short, we are not asking. So we're looking forward several notches along the way to what we anticipate our need is.
So you're going to see also, not just in the hospital or at clinics, but if an emergency responder responds to a car accident, they're going to be wearing a mask. Everybody who interfaces with people in those ways, all emergency responders are being equipped for that reason.
Okay.
I would just add that there's also a significant need for the staff that we have at the county that are providing direct services still, that are mandated by the state and the federal government to provide. And so we're also trying to figure out how to meet the need for first responders, healthcare workers, and the staff that still have to provide mandated services and protect them as well. So it's a challenge, but we're working hard and
Sure.
making the resource requests that we need.
Okay, excellent. I guess kind of dovetailing from the last question, there's been a number of media reports about kind of wonderful local community efforts to make these masks at home and supply them to hospitals or to healthcare workers. And from a wide variety of areas, we've seen kind of this incredible community desire to help. And I think a lot of people don't know what to do or how to do it. So I'm curious to hear from each of you if you have any ideas of how somebody who is, healthy, feeling good, at home, has time on their hands and maybe some resources can lend a hand to this effort.
Well, number one, we do have a lot of nonprofits that are helping the homeless and the unfortunate right now. Rescue Mission, Betty Chin, Arcata House. There's all these great organizations, Teen Challenge, that house people right now and that are providing the services. And so it's really, really important that they continue to receive funding. So if for people that are out there and that can, write a check, those are the places that can use it right now, because they are taking the burden off of the county and our state by doing something right now. And so I applaud those people that are trying to go out there and help. I think, number one, helping your neighbors, helping your families and loved ones. checking in on people is really, really important nowadays. And in this age of social isolation, it's difficult on people. It is really, really difficult. And so by checking in is something, by making a phone call is very, very important. So people stay connected and that there's needs out there being met. I'm applauding our local grocery stores that offer those senior hours and that are practicing the social distancing and allowing these the vulnerable population to go shopping during these times. I think that's outstanding. I think everyone else needs to be patient too. I know we're only in the first week and a half, okay? And it feels like a month. And so right now, we need to exercise patience in this time, and by allowing people to have their own space and to allow people to take care of others.
I would just add a couple additional thoughts, building on sort of the nonprofit issue and funding. There are also likely nonprofit entities, for instance, serving food, who may need volunteers or may be requesting people to volunteer if they're not in high-risk groups. And so I think it's something for people to consider. I think donating blood is an important thing that people can do. I think that, often because of shelter in place and other things going on, blood banks are at risk of having low supplies, and so that's huge. I think on our end, of course, we're working again with the healthcare registries to try and get people from all pieces of healthcare to step forward and help in this endeavor. And I think, in reference again to the sheriff's comments, I think anything people can do to help seniors and high-risk individuals stay at home, as opposed to having to go out for something, I think that can be really helpful. And that might just be something like calling someone and getting some grocery lists that they need and then leaving them on their doorstep. So those simple things can be really helpful to protect our most vulnerable.
I would just put a pitch for food banks too. I think that we all know that there's social media out there around Food for People, for example, and others that could really benefit from donations right now. They're feeding a lot of people still, and so I would put a pitch for food banks too if folks want to make donations there.
I think this impacts every part of life, and we have heard a lot about how it impacts businesses. And the latest figures are that job losses have surpassed 1,000 this morning, but there's actually probably a lot more. But interestingly enough, there are jobs out there too. The grocery stores needs extra people. It's very, very time-consuming to go out and clean every pen that's got to be used, but those are the ways that you can actually interface with the public if you keep things. So there are jobs out there, and that's one way, but the biggest way you can help is by leading by example. For people who think that they don't have to stay at home, lead by example. Be somebody who they might think, oh, they don't have to do it, well, do it, And the other thing is social distancing when you're outside. That's probably even more important, to be very cognizant of the fact of that. That's a help. I mean, it's not running and lifting someone out from under a car, but it's still absolutely helps people in the long run. So we're all in it together. As you said, help your neighbors, follow the guidelines, and then you can always, if you're a business, for instance, you can contact we have a special business line, 268-2527. Get some information about how you might be able to help there with giving extra personnel. And we have got to say thank you to other businesses who've stepped up and created hand sanitizer, for instance. So utilize your innovative brain cells and come up with another solution we might need. That would be great.
Excellent. Thank you. So I want to come back as we're running out of time here to testing one more time. And I know early on we talked about kind of limitations on capacity, and I'm curious when those limitations start to ease and there's a lot more available tests, how that might change approaches to community surveillance as far as testing, not necessarily at-risk populations, but populations at risk of spreading the disease widely. So healthcare workers, nursing home workers, Humboldt County jail inmates, things like that. And then as a second part of that, also if there's any plans to use infrared thermometers along the same lines as a way to kind of target people who might have the virus and quarantine them proactively.
So when we're talking about surveillance, typically we are talking about usually looking at mildly symptomatic people rather than screening asymptomatic. And the reason for that is that if I test you today and you were exposed 2 days ago, you may test negative. It doesn't mean very much. The following day, you may become positive. And so single point in time testing for people who are asymptomatic completely is not, I think, a good use of our resources right now. However, certainly as our testing capacity is increased, we've broadened our net to people who, again, didn't fit all of those initial categories, but are still having symptoms very consistent with COVID. And as we increase our capacity, my desire would be to be able to test those very mildly symptomatic people in some form. Usually that happens by, targeting, doing it sort of in a scientific basis and trying to get some sampling across communities. So we'll look at that as we move forward. I think meeting our need right now for testing, those high-risk entities, those people with consistent symptoms, and then broadening it as we go is sort of our game plan moving forward.
Okay. And is there any role for infrared thermometers in that, or are those not very effective?
Yeah, I mean, right now, what we've been doing in general is, I think fever in general is important to monitor for, particularly in certain populations, so our healthcare workers, however that temperature monitoring occurs, monitoring for fever is critical. I think in our general community members, while we're not telling everyone that they need to take their temperature twice a day in whatever fashion they can, certainly I think I want to encourage people to be just sort of aware of how they're feeling. That's those sort of things like I just don't feel quite right today, paying attention to that and using some of those indicators to check a temperature and then to watch over the next 24 hours. Is anything else different and changing? Because I do think that people understand at this point that if they're sick, they really need to be at home to decrease spread. But I think sometimes, people are minimizing symptoms and thinking, well, it's just a little this, whatever. I think it's important to pay attention to those signals because over a period of, 24, 48, 72 hours, you may be evolving into something bigger. And I think it's at that point, if you've still been out running around and doing everything you do, there's a potential that you've exposed people. So I just want to have people pay attention to how they're feeling and act accordingly.
Okay, excellent. And I guess the flip side to the person that isn't paying enough attention, there's a lot of anxiety in the community right now from people who are partially symptomatic, are symptomatic, and waiting at home, thinking about the worst. And so what advice would you give them as far as what they can do to manage symptoms and just what their outlook should be on letting symptoms run their course?
Sure, and that's a really good point. I think for people at home, we are really asking people with very mild symptoms, pay attention, and that's the trigger for you to really stay at home. So if you've been the person who's been going out to get groceries, for instance, maybe you're not that person now, right? You're that person who stays home until you figure out what's going on. If you're mildly ill, again, those recommendations stand, which are, if you're ill, mild respiratory symptoms, for instance, you stay home until you've had no fever without fever medicine for 3 days, until your symptoms are clearly improved rather than worsening. So that's important. And that it's been at least 7 days since the first onset of your symptoms. Using those tools will help ensure that people are not spreading that infection as they then recover.
Excellent. Looks like we have time for a couple more questions. Sheriff Honsal, I want to ask you about the jail, which we've got a number of questions from our media partners about. A lot of people think of the jail as a holding facility, but it's also a medical facility. I'm curious to ask what special precautions are being taken there to make sure there aren't any infected inmates, and if there are, they're quarantined quickly and there isn't a mass spread event.
Yeah. The jail is obviously it's its own community, and so we have to regulate it as such. And so we've made some drastic changes in the jail to prevent COVID from actually entering in the facility. So every person that's arrested that's going to get booked in the facility, they're seen by a nurse outside in the sally port. If they are symptomatic at all, they're sent off to the emergency room to get tested, treated, and we will not accept them in our facility. So if they are clear, they go into quarantine, and they go into quarantine for 14 days. And then once they are clear of quarantine, they are looked at they're looked at every day by our medical staff. WellPath is a company that provides nursing and medical direction inside our facility. And so they actually have tests that they can screen and then send off to private lab to get tested. And so we've done that already. And so far we are clear. And but they are keeping track of our inmates, of our staff, and to make sure that there's no transmission that takes place inside the facility.
And are there capacity issues associated with quarantining individuals? The jail doesn't have a ton of single cells, does it?
It does not. So we have to be creative, but we so far have done that. We've done that. We've isolated people, and so if we run out of that quarantine space, then we're going to have to look at some other things that we have to do within the facility. So we do have some plans in place, and so we're going to manage this appropriately and hopefully get through this quickly.
Okay. Another question that we've gotten from multiple readers and a couple media outlets is on the grimmer side of the spectrum, but
Okay.
it is about morgue capacity.
Yes.
At the coroner's office, and if there's any contingency plans being made.
So like any mass casualty incident, we do have capacity issues, and so it's something that we go into our planning for any natural disaster that may occur. And so we do have a capacity to have 20 to 30 bodies in our own morgue. We do have mortuaries that do have space, and we believe that number is around 40. So if there is more bodies than that, we have the ability to have outside resources come in and provide some space for that purpose.
Okay, excellent. And then I think I'm curious to hear from Supervisor Fennell if what she's hearing from constituents, as somebody that's one of your primary roles is just an interface between the government and people who elected you. What are you hearing about the response, about what their concerns are, what their hopes are?
I think the biggest thing that I've been getting is concern. People wanting to know how come they can't have more tests. People wanting to know why we're not closing down the county or closing down the airport, et cetera, and trying to explain to people why those things aren't happening at the same time as we are actually being quite responsive to some of the concerns that were brought up by people in modifying our policies, as you will see in Dr. Frankovich's latest order. But I think what I'm hearing a lot also is that people are in it for the long haul. They are going to stay in place, and they are going to do what they've got to do. And there is concern also, of course, about their economic future of the county and how we're going to rebound from this. And those are all things that we're all concerned about, you know. So generally speaking, though, I would say, and I'm very grateful to note that most people have taken it to heart and said, yes, this is a role that we can play if we stay in place. They make jokes about hanging out with their kids all day, et cetera, but the bottom line is they're actually doing what Dr. Frankovich would like them to do, which is to stay in place. And so I would like to welcome anybody who has any concerns. I know that I can get those concerns to the Joint Information Center or the OES. Give me a call. It's in the book. It's 476-2392. But call the information line for COVID, and that's all over the place. And sign up for the health alert also. That's very, very helpful. But again, a lot of what we're dealing with is the unknown. I've talked to people who said we never knew we would ever be dealing with something like this worldwide. And so it's up to all of us to respond the best that we can, and that's what I feel. I feel that from the community when they talk with me.
Excellent. I guess just on the note of it being kind of an unprecedented situation, I'm curious to hear from Sheriff Honsal as the head of OES and Dr. Frankovich for public health, who you guys turn to for advice. Who, obviously neither of you, I don't think, have been on the front lines of a pandemic before. So who do you talk to?
Well, Estelle just brought up something that I think is very, very important, is that Homeland Security gives us money every year. And Dr. Baird, the previous public health officer, built up our public health unit in the lab, which was very, very important. I mean, our lab, like Dr. Frankovich said, is great to have in this emergency. We're able to test. And that was prepared for years ago. And we're reaping the benefits of that now through Homeland Security money, through federal money. And so, the leadership of Dr. Baird in the past has been great for us to have a plan in place. All that is through emergency management. And who knew about our public health department had all this capacity and the ability to do all this and coordinate this massive effort in this time. I mean, it is something, again, that's unprecedented. But again, it's government's job to prepare for these worst case scenarios, and so we're reacting right now. So, but I think it's important to know that not one person has all the answers, and so by putting people together in our policy groups, I'm meeting with law enforcement chiefs every week, twice a week. We're meeting with city leadership, and to try and put all of our heads together, to put ideas together, to figure out how we can best approach this. And so I think that's an important point, and to know that we are really all in this together, and we're going to get through this.
I'd like to add on to that because myself and the sheriff were over in Williamsburg, and we were doing training for FEMA under the incident command system. It's something that even though we didn't plan for this particular one, we have the skeleton, if you will, the base for how you respond. You create these various ways of responding and communicating with each other. So even though we might not be able to pick up the phone and say, how do you deal with the coronavirus, we do know how to put an emergency response together. And that is the backbone now of what we're doing. Because Dr. Frankovich, I would say also, I'm going to say something about you, and I hope it's okay and correct. I believe that you did work with Dr. Fauci at one point, or you?
Oh, no, but I'm a huge admirer. Yes. I worked in, again, I'm grateful because in my previous role, I was serving as health officer in rural northern Michigan for 11 years. I can't imagine stepping into this role without having had that behind me, and obviously that informs everything that we're doing here as well, because as you both pointed out, public health has been investing time in emergency preparedness planning really for quite a long time, and I think a lot of it was really tipped off with H1N1. And we were lucky in that instance, in that H1N1 did not turn out to be as difficult a pathogen as coronavirus is, but it certainly ignited interest and effort in terms of being able to respond to something that actually was more of a threat.
Okay. Well, I thank you guys very much, and again, I thank all of the members of the public that submitted questions and my media colleagues. And with that, I'll give it back to Samantha.
Thanks, Thad.
Thank you.
Thank you, Ted.
So the time is now 7:48. We are going to give our panelists one last opportunity for closing statements. These statements aren't required, but if you do have something we didn't cover tonight and that you'd like the community to know, we want you to have that opportunity. So let's start over here with Director Beck.
The only thing I think that we missed talking about tonight was the eviction moratorium. I do think that it's important that the community knows that folks that are thinking that they don't need to pay their rent on April 1st without a plan, that's not the case. Folks still need to make a plan to pay their rent, and landlords, a lot of landlords use that as income, right? So folks that are strapped for funds and can't pay at this point, they need to reach out to their landlord, and they need to reach out to Health and Human Services or others that could assist with making that rent.
Thank you.
I just want to share my deep gratitude and appreciation and thanks to the public health staff. We are a small public health department, and we're often, we do our work behind the scenes, and the people, I think, of Humboldt County don't necessarily know exactly what public health does. And so we are a mighty team, and they have really shown their professionalism and expertise. And I think as a community, I need to thank them. They're just amazing. And also Dr. Frankovich, every day I'm reminded that she just came on, might as well have been yesterday. And this was her onboarding welcome. And I just don't know that we all realize how lucky we are, truly. And so thank you for that. And to the people of Humboldt County who are really taking this seriously, who are sheltering in place, who are sharing on social media the importance of this, who are talking about it with family and friends, who are holding each other accountable, thank you, because this is how we're going to get through this.
Doctor?
Hi. Well, again, to echo Michele, I think what I really want to emphasize to people is that, again, public health isn't a building. Public health is all of us, whether it's healthcare, schools, community residents, law enforcement, all of us. And really, at this point, I feel like working together, we can put Humboldt County in a position to succeed in addressing this pandemic. And it is incredibly important that everyone see themselves as a really critical piece of this response, because, we can throw out, sort of recommendations and, and provide some guidance, but people have to be following it and investing and believing in the fact that they can make a difference. And so I really want to thank everyone for what they've done so far. I know it's hard. And I want to say that your efforts are appreciated, and we need you to really understand that you are every bit as important to making this work as anyone else in the endeavor. So thank you.
It is, like I said before, it's difficult to get up here and to just really emphasize enough how much impact this has on all of us and all of you. We realize that. I think this gives us a chance to really think about our priorities in life. And so our family and our health is really, really number one right now. And it's what we need to focus on right now, and the safety of our community. Humboldt County is known to be a resilient community, a stubborn community at times, but we are resilient. And so I really, really want our community to come together, to get through this together, and to really, really focus on looking out for one another at this time. Push away from selfishness and look out for others. That's what I really want to have happen during this time.
Yeah, I would again like to reiterate that immense gratitude for everybody who is responding to this. And we talk about essential workers, but everybody is essential as far as this particular pandemic is concerned, as has been mentioned. We didn't talk too much about travel and essential travel. That's what we want people to be involved in. No non-essential travel. The order that Dr. Frankovich is announced tonight will also address rentals and who you rent to and who you don't rent to. And I just want to say again, a very big thank you to all the people working in the medical fields. I want to thank people doing that right now, not in Humboldt County, but as part of this big world that we're all part of. So, and we've got your back, and we'll be here for the long haul.
Thank you all for your perspectives. And thank you all again for tuning in tonight for our virtual town hall. Our COVID information line will be accepting phone call questions tonight until 9 p.m. and then opening again tomorrow for regular business hours. That's 8 a.m. to 7 p.m. on weekdays, 10 a.m. to 5 p.m. on Saturdays. That phone number again is 707-441-5000. You can also email your questions to covidinfo@co.humboldt.ca.us. For the most accurate local information regarding COVID-19, we encourage you to monitor our website, humboldtgov.org, or follow us on Twitter, Facebook, or Instagram at HumCoCovid19. Thank you again for joining us, and stay safe. Good night.
Good job, guys.
Really nice job.
Thank you, Thad.
Thank you, Ted.